narrative is that COVID happened, and within a matter of weeks, telemedicine was widely implemented. All is well, and medicine is forever changed. And yet the reality is much more nuanced. Hello, I'm Christine Sinsky, an internist and Vice President of Professional Satisfaction at the AMA. Along with my co-authors, Dr. Jim Jerzak of Bellin Health in Wisconsin, and Dr. Kevin Hopkins of the Cleveland Clinic, we wrote an upcoming article in the Mayo Clinic Proceedings entitled Telemedicine and Team-Based Care, The Perils and the Promise. All three of us have extensive experience with advanced team-based care with in-room support in-person visits. In this model, an MA or a nurse stays with the patient from the beginning to the end of their appointment. And during the physician component, helps with data entry and data retrieval, and helps to be the glue that holds the appointment together for the patient. They make meaningful contributions both during the visit and then after the visit, between visits, when the patient may have to call in, for example. And yet, with the switch to telemedicine, we each noticed that even among pioneers in team-based care, most, if not all, of the tasks of a patient visit reverted back to physicians who are now alone in the room, in the virtual room with their patients. And we are aware of the perils of this kind of time-pressured, divided attention. In our view, advanced team-based care is as important for virtual visits as it is for in-person visits. And we recommend that physicians and their teams develop new workflows to accommodate and continue the gains achieved with advanced team-based care and avoid a reversion to the unsafe doctor-does-it-all model. So in this paper, we describe two models of advanced team-based care for virtual visits. The first is with synchronous teamwork, at which point the MA or the nurse is present again throughout the visit from beginning to end and is present during the physician component of the visit. We feel that that gives them the strongest foundation on which to both make contributions that advance the patient's care and to be knowledgeable about the patient's care for any of the calls that happen between visits. And then the second model, which is available for those who may have less robust staffing, is a model of team-based care with enhanced virtual rooming. In this model, the teamwork is asynchronous, where the MA or the nurse meets with the patient ahead of the physician visit, perhaps the day before or just prior to the physician component, but then they log off during the physician component. In the paper in Mayo Clinic Proceedings, we build on this early experience and we envision some expanded opportunities for even better care using telemedicine in the future. For example, we may be able to bring in an out-of-town family member into an in-person visit, a daughter who may not have been able to come in for her mother's appointment where advanced care planning was going to be discussed. We now are so much more familiar with how to do this, we can bring that person into the visit even once we've returned to in-person visits. And then secondly, it gives us the opportunity to bring multiple specialists into the room together for a patient who does need to have their care coordinated across different specialties. And finally, in the paper, we suggest a research agenda for going forward. We know a lot more now than we did in the past about the feasibility of virtual visits, but we really still know very little about the safety, the efficacy, the comprehensiveness, the unintended consequences of this kind of visit. And we are just beginning to explore some of the novel opportunities that are available. So with that, thank you so much. I hope you enjoy reading the paper.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.